Hola a todos, muy buenas
Good
tardes.
afternoon to all of you. Thank you for connecting today to this press briefing offered by PAHO on COVID-19 pandemic in the Americas. My name is Sebastián Oriel with the Communications Department with PAHO, and as every week, this session will be 1 hour long, and we will be accepting your questions up to the end. We have already received your questions via email. You can also ask your questions live and also using the chat and the Q&A button. Please do remember to include your name and also media outlet whenever you send your questions. We also have simultaneous interpretation into English and Spanish. Today, the PAHO's director, Dr. Carissa Etienne, will be reporting on the current epidemiology of the COVID-19 epidemic here in the Americas, and also the deaths that we have had lately. We have Dr. Jarbas Barbosa, who is Assistant Director with PAHO, Sylvain Aldiguieri, who is the Incident Manager, and also Dr. Ciro Ugarte, who is the Health Emergencies Department Director. Now I'd like to give the floor to Dr. Carissa Etienne to share with us her opening remarks.
And a very good afternoon to you. And thank you for joining today's press briefing. In the Americas, over 44 million people have been infected with COVID-19, including more than 2 million over the last week. In North America, the United States is continuing to report the highest number of cases in our region. Mexico is reporting a rise in infections, with some regions of that country seeing tripling of cases over the last few weeks. There is also growing pressure on hospital capacity throughout North America. In some states of the US, nearly 80% of ICU beds are being used to treat COVID-19 patients, with similar rates in many Mexican states, just as some areas of Canada are reaching hospital capacity. In the Caribbean, larger islands like Puerto Rico and the Dominican Republic, Haiti, and Cuba are seeing an increase in infections. Smaller islands like St. Vincent and the Grenadines and St. Lucia are seeing a rapid acceleration of cases, with infections growing by more than 25% over the last week. By contrast, most countries in Central America, except for Honduras and Guatemala, are seeing a decrease in COVID-19 infections over the previous week. Going further south, Colombia has had the highest increase in cases of COVID-19 in South America. Cases are also growing in Paraguay and Chile, even as they are decelerating in Argentina and Uruguay. While hospitalizations are on the rise throughout much of the region, including in Colombia, Chile, and Peru, the situation in Brazil is particularly worrisome. Nearly 3/4 of all ICU beds in many Brazilian states, from the northern regions of the Amazon to the southern border of Uruguay, are being used to treat COVID patients. And many patients in the city of Manaus await hospital and ICU beds as rising cases challenge the health system. Over the course of the last year, we've seen this pandemic change from a localized outbreak to a historic global pandemic. It started nearly a year ago on January 30th, when WHO declared COVID-19 a public health emergency of international concern, an announcement that would set off the alarm for this virus in every corner of the world. Today, we mark another tragic milestone in our region. Over 1 million people in the Americas have now died from complications of COVID-19. We have lost more people to this virus than the entire population of many cities in most of our countries. 1 million people with hopes, dreams, and a future cut short. 1 million mourning families, many unable to say goodbye, who will feel their absence forever. Indeed, the scars and the lessons of this pandemic will stay with us. While the weight of this loss is incalculable, today I want to shine a spotlight on what this loss has meant to our region and highlight those most affected by this tragedy. We should start with our health workers, our heroes, who have cared for every patient that has been hospitalized for this virus. Throughout the last 12 months, our health workers have made extraordinary personal sacrifices to care for patients who have fallen sick. They've worked harder under more grueling circumstances than ever before. Many have risked their own lives and those of their families to care for those who are sick, and their heroic efforts have saved many COVID patients. Although there's limited data, we know that more than 1 million health workers in our region have become sick with COVID-19, and at least 4,000, most of them women, have died as a result, affecting our very ability to respond to this public health threat. I'm having a problem there. Yes.
Creo que la doctora tiene...
Problem, yes.
Ok, no hay problema, doctora Tien.
We are having an issue. Dr. Etienne has just had a small problem during the delivery of her remarks, and I am in contact with the technical team. We apologize. These are technical problems. It is always more challenging whenever we are virtually connected. I apologize. We are having some connectivity.
Si puede, a ver, creo que...
So I was saying that some 4,000 of our healthcare workers, most of them women, have died as a result and really affecting our ability to respond to this public health threat. And each of these people, each of them has a face, a name, and a story. And so in their honor, I'd like to recognize someone that we've lost due to this pandemic. Dr. Rosemary,
No, seguimos con inconvenientes técnicos, doctora. No
We continue to have some technical challenges. Dr. Etienne, we are unable to see you.
So I want us to recognize someone we've lost to this pandemic. Dr. Rosemary Costa Pinto, or Dr. Rose, as she was best known. She was the charismatic leader of the leading public health agency in the Brazilian state of Amazonas, which has been severely impacted by the pandemic over the last few weeks. She was a PAHO partner, a local leader, and a linchpin in the pandemic response, impacting the lives of millions in her region. Unfortunately, Dr. Rose fell sick and died from the very virus that she had been dedicated to controlling. So today we celebrate her life, and we thank the millions of healthcare workers still on the front lines of this virus who are saving lives every day. And we must ensure that their countless sacrifices will not be forgotten. I want also to touch on mental health. This pandemic has ushered in a mental health crisis as we've been shaken by fear, depression, isolation, and loss that is made especially acute as we mark this grim milestone of 1 million deaths. While we are all shouldering more stress, some groups like people living with disabilities or mental health and substance abuse disorders have been especially hard hit. Paradoxically, while mental health, Sorry, this is crazy.
Seguimos con los problemas, doctora. ¿Puedes continuar?
We continue to have some technical challenges. I am checking with Dr. Etienne. Can you continue?
No.
So our mentally ill and patients with disabilities are especially hard hit. Paradoxically, while mental health support has been more important than ever, it's also been more out of reach in these particular times. So data from some 29 countries have shown that in most of the countries in our region, many of them have suffered disruptions in mental health services. And these disruptions have been reported in more than a quarter of our participating countries. Of course, we need to talk about the economy. Many of our million people we've lost to this virus were breadwinners whose families depended on them for food and shelter. Today, 16 million more people are living in poverty compared to when the pandemic started. And millions of others are at risk of falling deeper into poverty in the wake of this virus. And as a result, millions of families are at risk of going hungry. Some of them have gone hungry for many months, a challenge that is made more complicated by rising food prices. So here are some of the recommendations that we want to put forward. We've said many times that this pandemic has brought a triple crisis throughout our region, as it has ravaged our health systems, fractured our social protection, and destabilized our economies. The loss of 1 million people from this virus should serve as an urgent call that we must do more to protect ourselves and each other from getting sick. This includes strong calls to action to reinforce the public health measures that are needed now in each of the places that are seeing outbreaks. We need to redouble our efforts to reduce, I'm very sorry. We need to redouble our efforts to reduce the number of new cases of COVID-19 and subsequent deaths. For example, Chile has lowered the transmission curve by implementing a successful health residency strategy that provides temporary housing for people diagnosed with COVID-19, as well as close contacts and suspects or probable cases who cannot quarantine effectively at home. As COVID vaccines are rolled out over the coming months, we need health systems to track vaccinations and to prioritize those most at risk of severe illness, like our healthcare workers and like the elderly, so we can reduce the demand on our hospitals. We owe a great debt to our frontline health workers. So I've been pleased to see that in countries where vaccinations are underway, doses are being prioritized for healthcare workers, and that's how it should be, with similar plans across other countries that will roll out vaccines soon. Broad access to vaccines represents our way out of this pandemic. But while supplies are limited, we need to focus on preventing new infections now to keep the virus under control. So while we feel the impacts of this crisis for years to come, and we will, today we face what it means to have lost 1 million men and women to this virus. As we remember the life of Dr. Rose and all those who have been taken from us, let us do everything possible to reduce the toll of disease and death from COVID-19 pandemic. Thank you so much, and my apologies.
Muchas gracias, doctora Etienne, y nuevamente si
Thank you very much, Dr. Etienne. And once again, we apologize for these technical issues that are sometimes commonplace in situations such as this one. But if you'd like to receive the remarks by Dr. Etienne, please do send us an email and we will be sending them to you. Now we will have questions and answers. Please recall some of you are already sending the questions using the Q&A button, and please do include your name and media outlet. We have several questions that were related to the hospitalization situation in several countries and the possibility for the hospitals to collapse in many countries.
Is PAHO worried about the possibility of health systems collapsing, Dr. Etienne?
So let me begin by saying thank you for this important question. You need to know that from the start of this pandemic, PAHO has been working to support countries in forecasting their health system needs, in identifying gaps, and working with them to expand their hospital capacity, including by establishing more ICU beds to care for severe cases. And we've seen remarkable progress with this, and this has undoubtedly contributed to saving many lives. For instance, within a few months, Chile added more than 1,000 ICU beds. Colombia nearly doubles its ICU capacity, and ICU beds grew nearly fourfold in Mexico. These efforts have been key to helping countries care for critically ill COVID patients. But as COVID infections surge, of course, hospitals risk running out of capacity to care for patients in need. And in truth, many countries are reaching a breaking point. Looking at data from 12 countries in our region, it shows that in early January 2021, 93% of hospital beds were being used by COVID patients. And some places are even more dire as hospitals reach maximum capacity and patients are being asked to wait their turn for a hospital bed, even if they don't have that luxury of time. But it does not have to be this way. And we can't emphasize this sufficiently. By practicing the public health measures that have been proven effective against this virus, like washing of hands, wearing of masks in public, and practicing social distances, we can each do our part to stop this virus from spreading. And importantly, by prioritizing access, including vaccines, as they become available, by prioritizing those in the greatest need, like our healthcare workers, our elderly, our citizens with underlying conditions, we can reduce demand on our hospitals. We have to bend that curve and we have to bring transmission down. And thus we will ensure sufficient hospital capacity. Over.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. The next question is by Anthony Malvado from Reuters.
The rollout timetable for COVAX in the region. What concrete agreements are there with companies other than Pfizer? What proportion of the region's populations will the COVAX doses cover? Y también pregunta, do you think it is advisable for Latin American countries to buy their own doses with development bank funding? Dr. Barbosa?
Thank you for this question. Let me start by the last one. PAHO has worked with the financial institution, the World Bank, the Inter-American Development Bank, IDB, and others financial institutions in the region, how to support the countries to get the funds to purchase the vaccines through COVAX or through bilateral agreements. So this was a very important initiative from our organization, because the countries are facing not only a public health crisis, as our director highlighted, but also a social and economic crisis. So if they can get loans with special conditions to support the purchase of the vaccines and other measures to enhance their capacity to respond to COVID-19 pandemic. This is really good news. Second, the deployment of the first vaccine through COVAX is scheduled for March. We are in ongoing negotiations with some producers. Maybe we can anticipate 1 or 2 weeks, but we prefer to establish the same date that we are announcing in recent weeks. We don't want to announce something that we cannot accomplish. So March, we will start the deployment. COVAX has made agreements with many producers so far, but remember that a producer to deploy the vaccine through COVAX, this producer needs to fulfill 2 requirements. The first one, to have finalized the agreement. We have agreement with Pfizer, was the last one announced the last week, 40 million doses for the first quarter of this year, and this will be a very important contribution. We have agreements with AstraZeneca, the 3 sites that are producing the AstraZeneca vaccine. We have agreements with Janssen. We have agreements with other producers. But at the same time, the producer needs to be pre-qualified by WTO or to have received the emergency use authorization. So far, we have only 1 producer that was pre-qualified by WTO, that is Pfizer. AstraZeneca is ongoing. The pre-qualification team in WHO is reviewing the process. It's not a simple process, it's complex because it's a decentralized production, and the Moderna also is under review. So we expect that until the middle of February, we have many other producers pre-qualified. For this reason, that in March, we can have guaranteed the deployment of the first doses of COVAX. This will be around the 165 million. And after March, in every month, we have an increment of the volume of doses. And in the second semester, we will reach the 2 billion doses that COVAX is aiming for this year. Thank you.
Muchas gracias, doctor Barbosa.
Thank you very much, Dr. Barbosa. We have several questions that are related to a question that has been presented by FP in Caracas, Gabriela Navarro's here, also in Kevin Natiara from Carabonero, Humberto Marquez from Interservice, by Despacho 505 from Nicaragua, and Glass Durante from Chile, and also Mariana from TV Venezuela. We have consolidated these questions, and they're saying Nicolás Maduro, president of Venezuela, announced Carbapenem on Sunday as a pharmaceutical product that he guarantees is efficacious against COVID-19. And the Venezuelan government also announced the discovery of an R10 molecule that has an effect against COVID-19, and they said that it was going to be presented to WHO for its qualification. Is this pharmaceutical product validated and accepted by WHO? And do you have any information about R10? Thank you, Sebastian, for that question. And first of all, I think it is important to say, as we have already mentioned in other press briefings, that PAHO or WHO do not validate any pharmaceutical products that have been redirected for the treatment of COVID-19, and this is something that has to be done at the national level. However, PAHO identifies, assesses, and sums up the evidence that is available on potential treatments by referring to scientific evidence and publications. It is important for research institutions to publish their findings by using clinical trials with very strict methodology and based on randomization. In the case of those molecules or pharmaceutical products referred to by the authorities of Venezuela, we would make the same methodology, publication, and design recommendations for scientific trials. This is our answer in connection to those questions by the journalists. I hope I have clarified how PAHO works and the situation right now. Thank you. Thank you, Dr. Aldiguieri. I would like to give the floor to Jacqueline Charles from Miami Herald. Jacqueline Charles.
I'm going to give you the floor.
Hi, good afternoon. In the last 2 weeks, we have seen a flurry of activity in the region where testing has suddenly become available in hotels, resorts, at airports, and even labs doing additional PCR testing. But for months in this region, in some countries, people have not had access to testing. How does PAHO feel about this? And is there a concern that we may be seeing two health systems develop in the region in the fight against COVID and inequality growing deeper as a result of the new travel measures that the US is pushing for negative COVID tests?
Gracias, Jacqueline. Doctor Ugarte, ¿podría contestar?
Thank you, Jacqueline. Dr. Ugarte.
Well, all considerations issued by PAHO and WHO for resuming non-essential international travel in the context of the COVID-19 pandemic caution against the adoption of international travel-related measures and interventions that might represent a false sense of security. For example, the body temperature screening, travelers completing forms, etc. But also what you mentioned, the testing, COVID-19 related testing. In that regards, specifically related with testing, as a measure to mitigate the risk of exportation or importation of SARS-CoV-2 virus, PAHO and WHO highlighted the suboptimal performance of currently available testing technology among low prevalence populations, tourists, travelers, and others, stressing also the explicit recommendation not to use antigen tests in asymptomatic individuals. And also PCR tests, that's the same thing. But many countries and territories in the Americas have limited laboratory capacity in diagnostic resources that are experiencing significant increase, and they are experiencing significant increase of COVID-19 cases during the last 7 days and even several weeks. And considering, regarding the order of the CDC and the related with the testing for travelers, PAHO considers that it is a situation that may force some countries to redirect some of the considerable proportion of testing equipment and laboratory capacity to international travelers. The situation may particularly affect the Caribbean, and several countries and territories in the Caribbean have indicated already that they may face some diagnostic stockout. And the days after the order issuance in terms of requiring tests for travelers, PAHO received multiple requests from member states and countries and territories in the Americas concerning the type of diagnostic test that will meet the requirements of the order. So bearing in mind the risk-based approach outlined in PAHO and WHO documents, we asked the CDC of the US to inform the public health rationale underpinning the CDC order in terms of mitigation impact, and also to whether this order is likely to be reconsidered or maybe reversed in the immediate future. We are in close contact with all member states and also the CDC in order to advise as we can in these regards. Thank you.
Muchas gracias, doctor. La
Thank you
siguiente.
very much, Doctor. The next question on the chat is from Jason Bouvier from NPR in the United States, and it reads,
Distribution of vaccines such as Sputnik V and others in the region that have not yet been authorized by the WHO, the FDA, EMA, or other major regulatory agency? Dr. Barbosa?
Thank you, Jason, for this question. This will give me another opportunity to clarify what are the distinct roles of WHO and the national health regulatory authorities. Each country has its own national health regulatory authority. Some of them are more developed, some are less developed, but this is part of a sovereign decision for each country. So each country has its own rules, regulations, frameworks, and the producer that wants to have their vaccines or products in their market, in this specific market, needs to ask the National Health Regulatory Authority to give a license to this vaccine, in this case. So it's a decision from each one of the countries. In our case, the revolving fund of PAHO's revolving fund, and the revolving fund has a tradition. We have bought vaccines for the countries in Latin America and the Caribbean for 40 years now. We only can purchase vaccines that are pre-qualified by WHO. So all vaccines are welcome, and all the producers that want to present their vaccines to be purchased through COVAX, they need also to present their dossiers with the full information about the safety, efficacy, and other information. So the pre-qualification team in Geneva and WHO will review and release the license. As I mentioned before, Pfizer has already received this authorization to be used. Moderna and AstraZeneca are being reviewed. We have contacts with many other producers that are bringing their documents, their dossiers to be reviewed by WHO, and we expect by the end of February to have maybe 4, 5, or 6 pre-qualified producers. This will be important for the countries. Thank you.
Gracias, doctor. Tenemos varias preguntas.
thank you, Doctor. We have several questions about treatment, one from Gisela Salomon from APE. Gisela, if you are there and if you would like to ask your question yourself about treatment, then please go ahead. Yes, thank you very much. As the pandemic advances in the country and the number of people who fall ill and die has grown, and people who are of lower income they tend to go to alternative treatments that have not been supported by science. In Bolivia, for example, the health authorities are advising the use of some herbs and other plants to fight the pandemic. So what is the reaction, what is the response of the Pan American Health Organization vis-a-vis these recommendations of alternative medicines? Are you in contact with the authorities of the countries that are recommending these alternative herbs and plants or other alternative medicine? Are you concerned? What is your advice? Thank you, Gisela. Dr. Alighieri, could you please answer? Yes, thank you very much for your question. This question has several dimensions, and I would like to address my first comments regarding the molecules and pharmaceuticals mentioned from Venezuela. And let me repeat the first sentence. PAHO identifies, evaluates, synthesizes periodically all findings published according to the methodology, and is always seeking and assessing evidence. of course, always searching for strong evidence. All this work, all these papers are published systematically after review, systematically. The latest publication is from January 13 or 14, and this includes all the publications we have found. And in those publications, we have not found so far anything relating to alternative therapies. I would like to say, though, that we are all focused on treatments for critical, complicated cases. And so, using the evidence published, PAHO afterward publishes guidelines for treatment after reviewing the evidence that is available. So, with a group of specialists, nephrologists, cardiologists, neurologists, etc. And after being reviewed by this group, recommendations are made for treatment of critical severe patients, and these guidelines are updated periodically. Let me also mention that either yesterday or the day before yesterday, we published WHO guidelines about management of patients. And it is clear that our goal, our objective at this point in time is to ensure the improvement of the standard treatment of patients with complications and critical patients. And in the findings in recent months that has allowed us to lower mortality of severe patients by 30%. There are measures that are accessible to countries with lower resources, and we are talking about recommending use of dexamethasone, which is part of the basic medication list for tens of years, and also monitoring patients who are not still complicated enough, but you can treat them at home by following their pulse. And also we have other medications that are accessible and to all health levels, and which can help. And the management of patients who are receiving ventilation with oxygen, which is not invasive. For example, a patient who is lying in a supine position, but there is a set of recommendations that allow countries of lower income to manage patients who have certain level of complication, as well as critical patients with medications that are accessible to all health systems everywhere. I hope I have answered at least part of your questions. Thank you very much. Thank you, Dr. Matias Otewi. I had a question also. Matias, are you there so that you could ask your question directly? And I give you the floor if you are available. Matias, can you hear us? Over, Matias, if you can hear. No, yes. I am here, Matias Loewi. So ivermectin was authorized in Argentina for COVID, and it has been extended use of this in the region. So what is it legitimate that a doctor tries these interventions just based on some meta-analysis results or effects on the viral load? What is your opinion about this? Thank you, Matias. Again, Dr. Aldigueri. Well, thank you for your question. I'm going to relate this question with the prior two. Well, first of all, we are talking about national systems of regulating medications, so the health ministries and those who validate medications. Second of all, we the new treatments need to follow randomized studies with a strict methodology and publish these studies so that peer groups can review the evidence. In the case of ivermectin, at this point in time, we have done 14 randomized studies that would include over 2,100 patients at this point in time. And the conclusion is that the methodological limitations and other factors determine that ivermectin is uncertain up to this point in time, given what we know at this point in time regarding safety and efficacy. We need to have appropriately designed studies for ivermectin so that we can confirm or rule out the results presented. So at present, you can see in PAHO's website the systematic reviews published in January 14 and 21st. At this point in time, we are not recommending ivermectin. More quality tests and trials are needed at this point in time. I hope I have answered your question. Thank you very much. Thank you, doctor. We have now some questions from the Caribbean. Nadine Wilson Harris from Jamaica Cleaner and Stephen Sterilian from PGD2 Radio in San Martin. Nadine from Jamaica Gleaner.
To start receiving the first batch of vaccines on April 21st through COVAX. Given the rush for vaccines, is this timeline guaranteed? And Steven Cyrillian from PGD2 Radio in San Martin is asking, has it been decided as to when the Caribbean countries most affected by COVID-19 will see the rollout of the vaccine? And how is PAHO assisting with the vaccination program for those less fortunate countries? Dr. Barbosa.
Sorry, Sebastian, can you repeat, please, the last question? I had some problem with my connection too. Sorry.
Yeah, no hay problema. Repito las preguntas.
Yes, I will repeat the questions.
Is expected to start receiving the first batch of vaccines on April 21st through COVAX. Given the rush for vaccine, is this timeline guaranteed? And the other question was, has it been decided as to when the Caribbean countries most affected by COVID will see the rollout of the vaccine? And how is PAHO assisting with the vaccination program for those less fortunate countries?
No, thank you for the question. PAHO is providing technical cooperation to the Caribbean countries. We have had many meetings with the Caribbean immunization programs, with the CMOs, with the ministers, covering several different topics that are very important to immunization campaign, such as communication to respond to the rumors, conspiracy theories, and things that can prevent people to get vaccinated, training of the professionals, and supporting the Caribbean countries also to access COVAX facility. The first deployment of COVAX facility is scheduled for March. We cannot provide exactly the date and the amount of doses for each country. This, we need to make this kind of estimation for 190 countries that are part of COVAX. But the deployment of vaccines through COVAX will be made in equitable access. So we'll be deploying these vaccines to the countries in the Caribbean too in March. We have an initiative that's called the First Wave Initiative that will provide a very limited amount of vaccines in February to some countries. This is a kind of a pilot project, and these countries, we are making a decision about what countries are ready and want to receive this small amount by the end of this week. But this is a This is a first wave initiative, so let's not make a confusion between this first wave and the first regular deployment of COVAX. This will be much. About the countries that have experienced an increase in the number of cases, let's remind also that this vaccine, we cannot use this vaccine yet to control an outbreak. It's a 2-doses vaccine, so probably the effect on the transmission will be only be made 4, 6, 8 weeks after the first dose. So it's important for the countries that are facing an increase in the transmission to adopt it, to strengthen the measures that we know that can prevent the transmission. Wearing masks, keep the physical distance, avoiding crowded spaces. So all these measures needed to be reinforced while we expect the vaccine arriving to the countries. Let's remind that until the end of the first semester, the access to vaccines will be very limited. So probably for the next months, we need to do these 2 very important initiatives. Starting vaccinating the most vulnerable groups in order to save lives, and at the same time, to keep the public health measures that can prevent the transmission. Thank you.
Gracias, doctor. La siguiente pregunta nos llega de Adolfo Cuicas.
Thank you. Adolfo Cuicas asked the next question from Peru. He says, last night, the Peruvian government decided to go back to quarantine, a measure that has been implemented in Bogota again. What do you think of this type of confinement at this point in time in the pandemic? Peru and other countries have been affected by the new variants. Is this the greatest danger? What can the nations do which do not have a way to detect these new variants? Thank you, Sebastián. Adolfo, according to guidelines from WHO and PAHO and the work that we do very closely with the countries, the basic guidelines are related to personal protection measures as well as physical distancing measures in the community. In every case, there is always a decision that needs to be made and has to be based on risk analysis. And the decision to impose a quarantine or restriction of movement or confinement in the community needs to be made based on risk analysis at subnational level, because at national level, it is very hard to do this. The increases in cases appears in different times and different places in a country. So several factors enter into this decision. First of all, the epidemiological evolution of the pandemic. Where are the cases? Where do we see the largest numbers of cases increasing? The state and saturation of health services. This mainly to prevent deaths due to the lack of ICU beds, for example. Also, there needs to be an analysis of the community's compliance regarding protection measures. This is an analysis that needs to happen basically to reduce transmission at community level, and also the transit of people or movement of people in different areas of the country, and also economic factors which are required for basic services to continue to go on. But the restriction of movement at community level needs to be taken advantage of by the people and the countries to reduce transmission. There is broad experience by the countries that have implemented restrictive measures, including isolation, quarantine, and even facilities, as mentioned by the doctor, as has been seen in Chile, where these measures have been able to reduce transmission and have limited the number of deaths. And this protects also against virus variants. So countries that have seen a significant increase in cases, these measures have proven to be very useful. In all cases, let me repeat, these decisions need to be made based on risk analysis, and should be the basis for restricting movement in communities. Thank you. Perhaps this is time to add something regarding the variants mentioned by Dr. Ugarte. Since March 2020, there is a Pan-American network of genomic surveillance of the virus, which is the agent of COVID-19. 32 countries and territories have been contributing isolates of virus, and they have been shared, thousands of them, in public platforms such as GS8. So it is important to know that there are countries which have national capacity to sequence the virus, and they themselves can do the viral analysis, the genomic analysis of the virus. Those countries who don't have that capacity, they can send them to at least two regional laboratories of reference and share. One is in a foundation of Cruz in Brazil, and also in Chile. There is another institute, and then there is also the CDC in the United States. So there is access to these surveillance services for decision makers who need to make public health decisions, and these decisions can be more accurate if they use these resources. I hope I supplemented Dr. Ugarte's answer. Yes, good that we're talking about the variants, because we have another question from Anthony Guader from Reuters.
Do you think the new variants are playing in the second wave we are experiencing throughout the region? And are travel bans an effective remedy for containing these variants?
Oh, thank you for this question, and which is another layer of complexity compared to the previous question in Spanish. The countries at this moment, at least 14 countries in this region are detecting variants that have emerged in other regions of the world or in this region. We have two sets of variants at this, so we have two sets of variants at this moment. For the variants that were first detected at the end of 2020 in Europe or in the south of the African continent, at this moment, the detection, these are very few cases, mostly at the beginning in travelers, international travelers, and people contact of these people. We do not see at this moment any impact on the dynamics of the transmission in areas where these variants have been detected. But also I'd like to mention one of the variants, and there are many that are under the scope of the regional network that has been detected in the Amazon region of Brazil. And this variant seems to have a higher percentage proportion among the detection of virus in the state of Amazonas, Brazil. So it's too early to say if that, in this case, there is a relationship between the detection of this new variant and the change on the dynamic of the virus, of the pandemic at this moment. There is an outbreak at this moment in the state of Amazonas of Brazil, obviously. This is reported by the federal and the local authority. So the importance is really to link the surveillance data people confirm with COVID with the variant, and the increase when, for example, when an increase of 50% in the incidence is detected in a certain area, there is really a recommendation to do more sequencing and to check what is the proportion, what is the participation of this variant. Regarding the travel-related measures, countries are sovereign to implement the public health and travel-related measures. What we are advising and recommending the countries is to use a risk assessment approach and compiling information, reviewing the scientific information available, and take the decision for protecting their people. I hope I have answered the concerns of the journalist. Thank you.
Gracias, doctor. Tenemos varias preguntas de periodistas de varios países.
Thank you, doctor. We have several questions from Panama, Guatemala, and Mexico. Dr. Barbosa, when would the COVAX vaccines be reaching these countries and the amount of vaccines? Claudia Rojas Toro wants to know if there are priority countries and when are the dates, and also another reporter wants to know when will the vaccine be arriving in Guatemala, and from Mexico as well. They say that they will be receiving 1.2 million doses of vaccine through COVAX. Yes, thank you for your questions. The delivery, as I've said before, will begin in March. We do not have specific amounts yet. At this point in time, we are doing an analysis country by country. I repeat, there are 190 countries participating in COVAX, and with the manufacturers, probably we will begin with Pfizer and AstraZeneca vaccines. There are some countries that are ready to receive both the Pfizer and AstraZeneca vaccines. Other countries do not meet the conditions to receive Pfizer's vaccine, which needs ultra freezing temperatures under 70 degrees Celsius. So this is our expectation. The countries, well, it is very important to reflect on equitable access. Our director has already mentioned this, not only this week, but last week as well. She has emphasized this. At this point in time, we have many countries who have started vaccinating, and it is great that they have started doing so. But if not all countries have equitable access to the vaccines, we won't be able to control transmission of COVID-19. So it's important that the United States made a significant announcement that they will be joining COVAX. So other elite countries can be making more donations to COVAX, and maybe they can use COVAX platform to donate vaccines, and so that COVAX can more broadly reach the region. I think COVAX facility will make it be the first time in the world to have equitable access by poor countries after richer countries. But I think I'm not satisfied with this. We should guarantee access for all countries at the same time. For such a great challenge, we should achieve true equitable access. Thank you. Thank you, Doctor.
Now I am going to give the floor to Lydia Lopez from Nicaragua. I am going to give you access to the mic. You have the floor, Lydia. I do not see her active on the chat. Lydia, shall we try again? Can you hear us? Let me tell you that we are going to be accepting a few more questions since we still have a lot of pending questions, so we will be extending this for a couple of minutes. The question is, the government of Nicaragua presented its vaccination plan to PAHO. What is the next step to be followed by the government, taking into account that the population doesn't have any further information on the process other than the one shared by PAHO? The US is one of the countries that is most visited by people from Nicaragua, but now that there is a requirement to present a negative test result, there are more requirements and there are more demands for the test. Do you have any information on the number of tests that have been implemented in the country? As we have already said before, PAHO has provided recommendations for planning from the budgetary point of view and also from the priorities point of view. And we understand that the authorities have already indicated that they are prepared and that they are also getting ready for the rollout of the vaccine. Dr. Jarbas Barbosa has already indicated the timing for Nicaragua and other countries to receive the vaccines through COVAX. As you know, Nicaragua is one of the countries that would be receiving a number of vaccines that have been donated, that will be donated by COVAX. So it is important for Nicaragua and for all of the countries to have immunization plans for the introduction of COVID-19 vaccines and for them to be reported publicly, in particular in connection with the priority population and also the logistical aspects for the administration of the vaccine. It is also necessary to implement the measures and to train individuals in charge of administering the vaccines and everything that has to do with vaccine information. As to the tests, the organization does not have information on the number of tests available or the number of tests that have been processed. Therefore, as you can see on our website and also in the various news articles, the analysis of the situation related to COVID-19 in Nicaragua is based on unofficial sources that include further detail, but it is quite difficult to ascertain what the situation is in the country. Thank you, Doctor. We have other questions on immunization. Jonas Valente from the Brazilian agency and also Fabiana Hernandez from Expansion in Mexico. Mr. Hernandez is asking, what is PAHO's opinion about vaccine purchases through companies? And that is a possibility that is being discussed in Brazil. And from Expansion Mexico, we hear that the Mexican government has authorized the private sector to buy their own vaccines. And the question is, how could this have an impact on the vaccination strategy in Mexico? Dr. Barbosa, thank you for the questions. Each country has their own national immunization plan. We are supporting the countries for all of the aspects that have to do with priority groups and also the logic to be followed for the establishment of priority groups, logistics, cold chain, professional training, regulatory issues for the approval of the vaccine, and all of this important information at this point in time. We have information on all of the countries. We already have information on 28 countries in the region where they report what their plans are, everything that has been complied with, and everything that is still ongoing. That is the way to monitor and also to provide some sort of guidance for PAHO to prioritize technical cooperation. Decisions are made by individual countries, but certainly most of the countries in the world are recommending to use the vaccine as a public health measure to save lives first, by vaccinating the most vulnerable groups, health workers, and workers from other social areas that are on the front line, and also the elderly or individuals who have chronic diseases who may also be more vulnerable to death due to COVID-19 and severe forms of COVID-19. That is the recommendation. Only after completing that phase can the vaccine be used with the expectation to control or interrupt transmission. Some models are indicating that we might need to vaccinate 70% of the population to reach that objective to control transmission. Therefore, I think that the great objective is to save lives, and the epidemiological criteria need to be used so that with equity and within each country, those in need for the vaccine have access to it. And I think that in that way, the population itself can understand why there are no vaccines right now in any country in the world for mass vaccination. Therefore, a decision made at the level of each country that has to be communicated to the population, because and explain why each group is being vaccinated separately. And I think that this is key to guarantee support by the population to vaccination, and also support for the other measures that are also important to prevent transmission. Thank you. Thank you very much, doctor. And we have a final question on vaccination. This is from Jorge Luis Perez for CGT and America. And the question is,
both from Europe and Asia in terms of vaccinations. Is there a risk that while much of the world starts to move on beyond COVID, that Latin America remains a no-go area with serious consequences for poverty in the coming years?
Thank you for this question. This, again, is about the equitable access. PAHO is, since the beginning, we are stating very clear that the world will not be prepared to face the COVID-19 pandemic and others public health emergencies of international concern if we don't have mechanisms to guarantee equitable access for protective personal equipment, for ventilators, for medicines, and for vaccines. I do believe that this is one very important lesson that we will have from this pandemic, and we hope that the countries can come together to establish, to keep mechanisms such as COVAX as a permanent mechanism with the proper funds to guarantee that no country will be left behind. That we will not only have in Latin America or poor countries in Asia or Africa and other countries waiting to get the access to vaccine. Yes, we are working hard with our member states to support them. We are working hard with UNICEF in the procurement for COVAX, and it's very important to guarantee that every country in the world will receive the vaccine that they need to save lives first, and after that, to control the transmission. Thank you.
Muchas gracias, doctor. Ahora sí ya estamos llegando al
Thank you very
final.
much, Dr. Barbosa. We're coming to the end of this press briefing offered by PAHO. We have here a question, a final question, and it reads,
The Americas have been the epicenter of this pandemic for months. Can you comment on why the Americas have been disproportionately impacted by this pandemic and what these figures say about the region's response to the pandemic? Dr. Etienne?
So let me thank you for this question. And yes, it is true that our region has been and remains disproportionately impacted by this virus. The Americas are home to more than half of all global COVID-19 cases and deaths. But I want to throw in one piece of information that we think in part contributes to the large number of reported cases. In the Americas, all of our countries have very strong surveillance networks and infrastructure. And throughout the years, many, many years, PAHO has worked with them to strengthen the surveillance system. For COVID, by the end of February, every country in our region had access to testing. PAHO trained and the lab professionals, and we distributed PCR tests to our countries. And subsequently, we, through our revolving funds, we supplied millions of doses of PCR tests. And when the rapid antigen test became available, we distributed thousands and thousands to our countries. So I think, and that is not so for every other region. So I think that in part, and I feel that's very noteworthy, that the figures that we are seeing demonstrate the expansive commitments throughout our region to diagnose, track, and report COVID-19 cases. I think also that it also lays bare how the pandemic has been fueled by inequality. Our region is highly urbanized and among the most unequal in the world, and this has made adherence to public health measures a challenge. People living in close quarters or dense urban communities cannot properly self-isolate if they're sick. And I told you what Chile was doing to improve this. Our essential workers and those who rely on the informal economy for their livelihoods, they don't have the option to stay home. And for people living in marginalized settings and remote areas, like our indigenous communities and migrants, healthcare is often and remains out of their reach. So let me reiterate that inequity has brought us to this point, and solidarity will pave our way out of this pandemic. As countries begin receiving shipments of COVID-19 vaccines, access should not be based on privilege of the wealthy or privilege of certain communities. We believe that doses should be prioritized for those at the highest risk of developing severe COVID-19, like our healthcare workers, like our elderly, and all of those who work on the front lines of this pandemic. And as more doses are available, we must ensure fair and equal access. I believe that our collective ability to combat this virus depends on how we uphold our promises to health for all. And this region has stated its commitment to universal health for all, universal health coverage, and universal access to health. That's what is going to make sure that we can come out of this pandemic and that we can build back better for the future. Thank you.
Muchas gracias, doctora Etienne. Y bueno, muchas gracias.
Thank you very much, Dr. Etienne. Thank you all for being with us today. Let me remind you that you can continue to communicate with us via email and also find updated information on PAHO's website, paho.org/coronavirus. And as Dr. Etienne already mentioned, we will be sharing with you, she already mentioned in her opening remarks, we'd like to close today by remembering Dr. Rosemary Pinto from Brazil, and also remember those in the front line that lost their lives in this fight against the pandemic. Thank you all for being with us today, and we will meet again next week. Thank you.